even just thinking about it now, I guess I want a bit more clarity. Would you say that the negative self-talk is like a symptom of something greater, or is it like, I'm sure the answer is sometimes and sometimes it's not, but like, I'm trying to understand, like, when you look at negative self-talk and being kind to oneself and things of that nature, um, are those like diagnosis and treatments that you're looking at, like as far as like you need to talk kinder to yourself, or is it a like an identifier to gather data to have a greater understanding of like the whole? Could you maybe talk a little bit more about how you utilize them in your professional setting?
Sure, that's a great question. So I think with what I was talking about, with it being a symptom, one example is intrusive thoughts, and I'll come back to that. With the aspect of critical self-talk, that's first of all, and I can tell you've been talking to psychologists, because I think you said like the answer is probably yeah, sometimes it is and sometimes it isn't. That's exactly what it is. And also everything occurs on a spectrum, right? You could read symptoms for any number of things and think that you have that because you just read it. It's different than when you see it, when it's happening at a clinical level of distress, level, or when it's happening, with a given client. But with negative self-talk, so that's the kind of thing that a lot of us engage in to some extent. And in general, the question is, does it work for you or does it not work for you? The sad thing is, a lot of people think that they need that negative self-talk, and that's the thing that keeps them going, when it's often the thing that holds them back. Typically, in my work, I think that's what I pay attention to when I'm working with clients within the context of the critical self-talk, is that that's something often that's mediating, or in a way, like spurring on more, let's say, anxiety or depression, right?
Mhm.
You're not good enough, at this, you're always going to fail. And so that might be something, an intervention point, because if we could decrease that negative self-talk, then maybe you will try and apply for grad school, or um, it could lift some of the symptoms that are there. So I don't look at that as specific like diagnostic, but I think it's a process that can contribute to a lot of different symptoms that we see. But then also with interpersonal trauma, that's something that could be more prevalent, um, and that can have to do with our attachment with our attachment styles, or our relationship with caregivers, and how we've learned to kind of communicate with ourselves, how maybe our caregivers talk to us, or the absence of talking to us, or providing us with that unconditional positive regard. So sometimes with interpersonal trauma, then I'll see that be a little bit more prominent, but more so I think of it as an intervention point to decrease some of those symptoms.
Got it. That
Um,
makes sense.
yeah.
Would you say then that, um, like, if somebody was identifying that they do engage in some negative self-talk, like you said, most of us do, um, and how would somebody go about identifying for themselves if this is something that's productive or not for them in their process? Is it something that people should be seeking, some guidance from their outside life, or is it something that people can figure out, like, man, this really isn't helping me, I need to stop? Or how should people go about that?
That's a great question. I'll think for it. I'm going to think for a moment,
Yeah.
because I normally experience this from a clinical standpoint in the therapy room.
Right. Yeah.
And so I identify it because people will out
Yeah, that
loud.
you are the outside source that people get
Mhm.
this from, right? Of course.
Yeah. And in some ways, one way we could pick up on it is the people in our lives will tell us when we're saying these things, because often out loud we say it without even realizing, oh my gosh, that was so stupid of me. Or,
Mhm.
oh, I can't, I know I need to take a break, but I have to study or else I'm going to fail. And kind of that tendency of being rigid on ourselves. And so I suppose one way is, I guess you wouldn't necessarily ask the people in your
Mhm.
life, but is you could pay attention to what needs are not being met for me, and what am I doing, and is it working? And chances are, um, and what's the role of self-criticism in those pieces? Like, did you stay up and keep studying rather than go to sleep on time because you felt like you had to push through it? An act of self-compassion is taking care of yourself, taking care of your body, and saying, okay, I have the right to relax. And that often will lead to us being more effective and studying better the next day. So I think part of it is maybe even writing out, what were the behavior of a time when I didn't take care of myself? What were the thoughts I was experiencing? What were the feelings that I was experiencing in those moments? And then you might see a pattern of some self-critical thoughts.